Well, good afternoon. Thanks for joining us today and coming here to listen. I'm a family physician, and I've been working with Wisconsin Health Literacy for about 15 years on health literacy, a variety of projects and that sort of thing. And so I hope that my goal for this is to give you a very high-level introduction to health literacy. And a little bit about literacy and how those literacy and health literacy sort of interact and overlap. But it's going to be really high level. I'm going to zoom through things. I know that I'm going to overwhelm you, but my PowerPoint is available online. You can get it. You certainly are welcome to take notes and that sort of thing. I'm going to pause a few times through the presentation for questions. And we hopefully will have enough time at the end also to do a little bit more in terms of questions. So a couple things for me to tell you. I do have a conflict of interest. I am a consultant for Wisconsin Literacy Incorporated, the folks that are putting on this conference. I'm also a co-investigator for a health literacy diabetes project that's funded by Merck, which is a pharmaceutical company. Just so I understand a little bit about the audience here, how many of you, this is your first time in Madison? Just put your hands up. Actually, not very many. I was expecting more. And how many of you, this is your first time you've come to one of our summits? There we go. Okay, a lot more of you. That's expected. And then, what do you do as your sort of main job? How many of you are involved in healthcare in some way? Quite a few. Okay. Literacy, folks that work with adult literacy? Good. Oh, a few of you. Great. Even if this is not your main thing, any of you have been involved in a research project in some way, participated in research? A few, not too many, maybe more than I would have guessed. Library folks? Great, got a few, okay. And anything else? No hands? Hear me? What? Academics, okay. All right, so very quickly, I'm going to go through a brief history of health literacy, like a lightning round, general things about literacy and health literacy, why it's important, what's kind of going on in the field right now, and then some resources that I may just buzz right through depending on how much time, just so that you know that they're there. And if we get to it, have a couple of minutes, we can talk about some cool things in Madison you might want to go see. And at the end, there's some handouts at the back if you're interested in local restaurants that are within walking distance. There's handouts at the back about that. So, brief history. Health literacy, the first time it actually appeared somewhere, it was like 40 or 50 years ago in publication. But here's some kind of seminal events, sort of important things. You may have heard about the Rapid Estimate of Adult Literacy in Medicine. It was the first way of measuring health literacy in some way. The article that with the validation work was in 1991. So that was like the first measure that was really available to us, or REALM is the acronym for that. Second time the federal government assessed literacy in the United States was the National Assessment of Adult Literacy, or NAL. There's like acronyms everywhere here. 2003. First sort of seminal article, big article about health literacy, and how they impact health and health outcomes came from what was called the Institute of Medicine, now also known as the National Academy of Medicine. 2004, the Prescription to End Confusion. This like really kick-started health literacy and brought it to national attention, was this article here. And then things started flowing after that. Somebody created in 2010 a national action plan to improve health literacy. 2012, the 10 attributes of a health literate organization was published. 2016, the first journal specifically devoted to health literacy published its first article, Health Literacy Research and Practice. And the first national and somewhat international organization about health literacy in the United States is the International Health Literacy Association that was founded in 2017. So it's been going on for a while, but we're really just kind of at the beginning when you get right down to it. So, of this list that you see here, which one of these is the single strongest predictor of a person's health status? Age, income, literacy skills, employment status, education level, racial or ethnic group? Anybody want to guess? It's literacy skills, not surprising. But what is literacy? So we're going to talk about the National Assessment of Adult Literacy. This is the definition. There's lots of different definitions of literacy, but this is the one that they used. Using printed and written information to function in society to achieve one's goals, and to develop one's knowledge and potential. But it's a combination of skills. I've been working with adult literacy folks for a long time now, and if you think about it, this is still just a subset of the skills that are necessary for literacy. There's verbal literacy. You need to be able to have the words to describe what's going on, have the vocabulary to describe things. Think about how many different words there are to describe pain. Sharp, dull, lancinating, burning. There's all these different words that we have for describing pain, and you need those verbal skills. You need listening skills. You need to be able to take information in that is being spoken and be able to process it, make sense of it, use it in some way. Numeracy. Numeracy is numbers. Lots of people have trouble with math and numbers and understanding percentages and things like that. Big issue. And then you need to be able to put that together in some way. So you gather this information, you hopefully understand it, try to make sense of it, and then you need to have critical analysis skills to actually, how do I apply it to me or to my situation or to my family member's situation or whatever. And then there's writing and reading skills. And of course, literacy, the reading skills, there wouldn't be just one kind of literacy, right? So when we talk about the national assessment, they looked at 3 kinds of literacy. Prose literacy, which is what most people think of literacy, which is written text like instructions or a newspaper article or a patient handout. Document literacy, which is short forms of graphically displayed information that you find in everyday life. Things like a bus schedule or a prescription label. And then quantitative literacy, which is a little bit different than numeracy, and that's arithmetic using numbers that are embedded in print, like trying to look at a nutrition label and try to figure out how many grams of fat are in there, how many calories in that pint of ice cream you're about ready to eat. So if that's literacy, then what's health literacy? This is a subject of great debate right now in the field, like how do you define health literacy and what's really important and that sort of thing. But that seminal article in 2004 from the Institute of Medicine, this was the definition that they have in there. This is often, if you Google health literacy definitions, you'll often find this or a variation of this. The degree to which individuals have the capacity to obtain, process, and understand basic information and services needed to make appropriate decisions regarding their health. Dean Sillinger talked about that this morning. So key concepts here, understanding and making decisions. And that's a lot of what healthcare is about, is understanding information and making decisions with that information. So literacy and health literacy, they're certainly not exactly the same. It took me a while to kind of figure out where's the overlap and where, how are they different, how are they similar. So if you think about it, almost anybody could have trouble with health literacy at some point in time. As an example, when the neurosurgeon is pregnant and she goes into labor and she's in the hospital and she's laboring and she's now been in labor for 36 hours, so now she's sleep deprived and she's worried about herself and her baby because she's been in labor for 36 hours and she's in pain, and then we give her medicines to help with that pain. This anxious, sleep deprived, medicated, very intelligent, articulate, literate person may have trouble understanding and processing health information and making decisions. And then think about what it would be like if English was not your primary language, or you couldn't read very well, and all the documents and posters and all the things that are around that are in text, how much harder it would be if you were in that same situation, but you didn't have good literacy skills. So the problem with that Institute of Medicine definition is it puts it all on the patient. Finding, understanding, using, which they don't talk about in that definition, using information. But there's 2 sides of this equation. There's the people who are looking for information, patients, students, everybody, depending on your situation. And then there's the folks that give information out, and that's healthcare providers, people in public health, anybody that's involved in the health system, and lots of other people in other roles that are trying to provide health information to folks. So the people who are looking for information need to be able to find it, understand it, evaluate it. They need to be able to communicate their needs, ask questions, and get them answered, and then use what they learn, ideally act on it, hopefully to live a healthier life. And those folks that are giving information need to do the flip side of that. So we need to help people find health information, help them understand the information that they find or that we give them. assure them that we understand them and their concerns, be sure that we are communicating effectively and well with patients. Oops. Anticipate and encourage questions. People are very reluctant to ask questions in a healthcare environment. So how can we encourage them or just go ahead and give them the answers that they might not be willing to ask on their own? Help them evaluate the choices that they're facing and try to just make it easier for people to use the information. That is, what are the barriers in the healthcare system? Can we make the steps less onerous? Fewer steps, make it easier. Can we smooth the path for them so it's easier to get things done once they figure out what they want to try to do? So the next thing I'm going to show you is a brief video that I shamelessly stole from the AMA. You may have seen this before, the American Medical Association. I edited it down, and this is available on YouTube. So if you want to show this as part of a presentation or get someone else's attention about health literacy, it is readily available. Just Google AMA Health Literacy Video short version, and you'll find it. So the video quality is not very good, but it's the words, it's the stories that people tell that I want you to pay attention to.
I was sick a lot. I was sick a lot because I probably missed dosage and didn't realize it. I was in the hospital a lot. When they did give me medicine, I didn't take it right. I admit to it. I just didn't understand them, and I didn't have the nerve to ask them the right way of doing it. I just didn't have the nerve to ask them, and I didn't want anyone to know I couldn't read.
I can't read this. Well, I guess the doctor gave it to me, so it's okay for me to take it.
When your children have fever, what do you usually give them?
Motrin or Tylenol. Normally Motrin because that's what my doctor recommended.
How old is your daughter?
She is 4.
She's 4, okay.
I would give her the 4 to 5, a tablespoon and a half.
One capsule.
That's right. One capsule?
One capsule. I don't know what this is.
Twice?
Twice daily.
Okay. So how would you take this?
When I see it's not on, I tell you how to take it. It says take it twice daily, but it don't say what time to take it.
Do you know what hypertension means, if I asked you what that was? Because when I look at this, I think, well, maybe you have hypertension, and I've been taking care of that for a long time.
Hypered? Hypered?
Like you're hyper? What does being hyper mean to you?
That's where you can't be still. You always got to be doing something.
Do you think I think you're hyper and have hypertension?
I don't know. That's what I consider it.
Okay.
It being, you know.
Okay. But you know you have high blood pressure. Okay. But hypertension doesn't mean the same to you. So if I ask you if you have hypertension, you're going to just think I think you're jumping around on the chair or something like that. Something different.
Just being hypered, you know.
Okay. All right. Well, I haven't done a very good job teaching you what hypertension is, because I think you take that medicine for your hypertension, and that's one of the things that I try to work with you on is your blood pressure. And high blood pressure and hypertension, to us, is the same thing.
The same thing.
Yeah.
I have a small breakfast, and then I take my pills. I usually take 16 every morning. Sometimes it's difficult to for me to take these pills because if they say 1 tablet twice daily, I don't know if they're talking take 1 in the morning, 1 in the evening, or take 1 in the afternoon or 1 in the evening. So usually what I do is take 2 of them in the morning. Then this way I know I have them.
If you have a reading problem, you go to the doctor. That can be very scary. It's like a nightmare. You walk in that office, and most people, if you realize the first thing you're going to have to do if that's your first visit is fill out a form. Your heart beats real fast. You're scared. You don't know what to do. You want to turn around and walk out. I have.
At approximately 30 or 31, I went into the gynecologist and complained about part of this not working correctly. And he said, we can repair that. Great. I didn't ask all the right questions. When I showed up 2 weeks later at the admissions office at the hospital, they put enough papers in front of me. I'll bet there were 5 papers that I needed to sign. Well, I wasn't going to say, excuse me, but I don't read really well, and I certainly don't read fast, and I'm concerned with some of these words. To me, it was lines and circles over sheets and sheets and sheets. And I wasn't going to reveal my sense of stupidity, so I signed everywhere they told me to sign. Never read it. And then a couple weeks later, in the follow-up office visit, the nurse said, "How are you feeling since your hysterectomy?" Now, I acted as normal as I could. Inside, my mouth fell open, and I thought to myself, how could I be so stupid as to allow somebody to take part of my body, and I didn't know it?
Those are pretty powerful stories. Are these people unusual? Are they outliers, as they say? Nope. So, who's at risk for these kind of problems? And what happens? Does it really matter? There have been 3 times when the United States government has assessed adult literacy in 3 slightly different ways. The most recent one is the Program for International Assessment of Adult Competencies, the acronym is PIAC, published 2011 to 12, 5,000 adults aged 16 to 65. They released the results in October of 2013. The bottom line out of 3 different assessments of adult literacy in the United States is it has hardly changed at all in 20 years. Our educational system, they're not sort of catching up and aging out. It's really staying flat. As a comparison, the PIAC was conducted in a bunch of other foreign countries, including Japan. And in the United States, 1 in 6 adults lacked basic academic skills. Yet in Japan, which had the best results, it was only 1 in 20. So it gives you an idea where we are in the United States compared to the rest of the world. I'm going to talk about the 2003 national assessment because they actually did a health literacy assessment. They assessed more than just prose document and quantitative literacy. And so this data, 2003, keep in mind things haven't changed much even since back then. 17,000 people participated. They looked at people over age of 15 living in households and prisons. The reason they looked at the prison population is we have a rather large prison population and we know that they have lower literacy levels. They divided people into 4 categories of functional literacy, what they could do with written information, below basic, basic, intermediate, and proficient levels. Somebody who's at the below basic level can deal with a single piece of information. They can sign their name on a document. They can identify a country in a short article or total a bank deposit slip. They'll have difficulty entering information on a Social Security card application, locating an intersection on a street map, or calculating the total cost on an order form. Somebody at the basic level can deal with 2 related pieces of information. So they could identify a year-to-date gross pay and a paycheck, if you still got a paycheck or you looked it up online, or determine the price difference for tickets for 2 shows. But they'll have difficulty using a bus schedule, balancing a checkbook, or writing a short letter explaining an error on a credit card bill. If you put together below basic and basic literacy levels, and you look at those 3 different ways, prose, document, and quantitative literacy, between 34 and 55% of American adults are in the basic and below basic literacy levels. 1/3 to half of the entire adult population. I was astounded the first time I saw these numbers. Why don't we hear about this? It's a national embarrassment. It's a problem. As I said, they did do some health literacy assessments. So 28 of the questions from the NAL test, the NAL assessment, were specifically related to health. And so that subset, that's specifically looking at health information. 3 of them were clinical, 14 about prevention, 11 about system navigation, insurance, and that sort of thing. So these next numbers I'm going to show you are just that subset, the health literacy questions. And so if you look at the entire population of adults, a grand total of 12% are considered proficient at health literacy. 12%. Intermediate, 53%, that's the biggest group. Basic and below basic, 22%, 14%. If you put those together, it's 36%. So to look at that a little bit different way, here's a pie chart with the same sort of data. There's that 12% in red. The rest of the folks are in the other levels. And oh, by the way, 3% of the population that they tried to take the test, they were so low with their literacy or their ability to read English that they were not even able to take the test. So there's another 3% on top of that. If you start to look at this and break it down, well, what about these different populations? So if you look at the entire population, basic and below basic health literacy, 36%. Not surprisingly, whites are a little better, only 28%. Native Americans, 48%. Blacks, 58%. Hispanics, 66%. Basic and below basic health literacy. You look at it by age. I grouped everybody between 16 and 64, 28 to 34% basic, below basic health literacy, but the Medicare population, 65 and over, 59% of those folks basic and below basic health literacy. And then if you look at it by education level, you would think that education level would be a pretty good proxy for literacy, but it's not. About 10% of people who graduate from high school are actually functionally illiterate, but they manage to get through. But if you put folks that are in high school, they have a graduate education degree, a high school equivalency, or they are a high school graduate, 34 to 37% of those folks are at basic and below basic health literacy. But if you're an adult and you're not in school and you do not have a high school diploma, 76% of those folks are at basic and below basic health literacy. One of the other things that they did is they asked people to self-rate their health status. Are they excellent, very good, good, fair, and poor? And what you can see as you look at these numbers is there's this obvious gradation. So in the excellent group, 25% of them that said their health was excellent, 25% were at basic and below basic health literacy. And you get all the way down to poor, self-reporting poor health, 69% of them are at basic and below basic health literacy. So clearly there's an association here, but we're not exactly sure what's going on here. But there's something going on here. So the first part of health literacy and people trying to figure out what was going on was to get some measurements and then try to measure what health literacy in a population and see, did it matter? Is there anything that it influences as far as health care or health outcomes and that sort of thing? So that was the next step. And so the things that we know is, not surprisingly, there's poorer health knowledge, poorer health status, as I just showed you. A higher mortality. People tend to die younger when their health literacy is lower. There's an increased frequency of hospital use and an increased frequency of emergency department use. And the results are kind of mixed about use of preventive services, chronic health care, and tobacco use. Here's one example of poorer health knowledge. About 400 patients were assessed their literacy level and divided into these 3 different categories: low literacy, marginal, and adequate. And they were shown 5 prescription bottles and were asked initially to just read the words of the instructions on the bottle. Just read the words. This is the percentage of people that got at least one of those incorrect. So 63% of the low literacy group got at least one of them wrong. That may not be surprising, but what surprised me and what's the little most scary thing is the group down at the bottom. 38% of the folks that supposedly had adequate literacy got at least 1 out of 4 wrong. And then they asked them to follow these instructions. Take 2 tablets twice daily. What would they do? And as you saw from the video, or hopefully heard from the video, that twice daily, people have trouble with that. So the words, the people who could say the words correctly, 71% in the low literacy group. Oh, actually, one more very important point. To be counted correct for the answer, all they had to do was put 4 pills on the table. That was considered a correct response. 71% of the low literacy group could say the words correctly, but only half of them, 35%, could count out 4 pills. And then down at the bottom, the adequate literacy group, only 89% could say the words correctly, and 80% of them could count out 4 pills. Increased mortality, about 2,500 participants. This is a pretty big study. They assessed their literacy levels and divided them into 2 groups, 8th grade level and above, or less rather, and 9th grade and above. And they followed them for 5 years just to see how many of them died. And if you just strictly look at how many of them died, the low literacy group, 19.7, about 20% of people died in that group. but it's only 10% in the higher literacy group. And then I'm a family physician, I'm not a statistician, but statisticians have this sort of magic where they can take numbers and they can do adjustments and they can try to adjust for other factors that we know influence a particular outcome. And in this case, they looked at just health literacy and what was its impact on that. You know, the other things like men die younger than women, if you have multiple medical conditions, if you smoke, you're more likely to die, all those things influence mortality. And if you just look at the literacy side of it, they still come up with this what's called a hazard ratio of 1.75. If it was 1, literacy would have no impact on mortality. If it was 2, you'd be twice as likely to die. So even adjusting for all the other factors that we know of that influence mortality, literacy was the strongest one. 1.7 was one of the highest ones, 1.75, almost twice as likely. The only thing that was higher was people that were actively smoking. Those people were more likely to die than the folks in the low literacy group. So as you think about this, and especially for you folks in healthcare, is it surprising that people don't take medicines or do other things that we ask them to do if they can't read or can't understand information? Increase in people not showing up for tests or to see a specialist. Can you imagine how hard it is to act when someone hands you a card that has lines and circles on it, that has the appointment time and where to go for a test or a referral, and how difficult that would be if you can't read very well or English is not your primary language. So yeah, it's a big problem. Now, what do we do about it? There's a book called Switch. Has anybody read Switch? It was published probably 8 or 10 years ago now. And one person read it. Yeah, it's a great book, isn't it? It's how to accomplish change when change is hard. And we're talking about hard change here, changing the healthcare system. And one of the things they recommend is that if you're going to lay out a problem, then you better give a vision for where you think you're going with trying to solve this problem. Well, this is Paul Smith's vision of what I think we ought to be aiming for, and that every patient or their caregiver, because obviously some people are never going to be able to understand, that those folks can understand what the health issue is, preventive care, chronic disease, whatever it is, what to do about it, and why it's important. Does that sound familiar? Have you ever heard of Ask Me 3? That's basically Ask Me 3. So how do we get there? Well, education is one thing. I mean, we can try to educate patients, and hopefully we could someday someone will fix our current educational system, which is kind of failing as far as people reading. I'm not going to fix that. Probably none of you out there are going to fix that. But we still have all the adults that are out there who are probably not going to go back to school to learn how to read better, and we still have to deal with those folks. And that's where effective communication comes in. I think that's the key. From the healthcare side anyway, the information giver side, is what we can do is be more effective in our text and verbal communication. And then there's a concept called universal design. It's an engineering concept. Anybody out there, quick raise of hands, heard of universal design? Couple of you, okay. It's the idea that you can design anything to make it easier for people to understand how to do it or what to do with it. So, from an architectural point of view, how many of you have ever walked up to a building and not known what door to go in? Has that ever happened to you? Yeah, it's happened to me. How hard is it? You put something out there that like sticks out and there's doors in it, maybe it's colored or something, you know, to make it so it's easy to get into. And with electronics, now you probably did this as a kid. How many people had a VCR as a kid? Or their parents had one, and you probably had to fix it every time the power went out and get the time back to set the correct time because it was so hard to do that. So that's another example of poor universal design. But if you can figure out how to convey health information to someone who cannot read very well or English is not their primary language, you're actually making it easier for everybody to understand that information. And that's the universal design concept. So what do we really need to do? Well, we need to kind of fix everything. I'm going to speed this up a little bit. A lot of it comes from grassroots. It gets started there, but you have to have leadership buy-in. Leadership can give you resources. They can have people, which means money and actual dollars to spend on things. And as you think about, oh my gosh, how am I going to add health literacy to everything else that I do? You can infuse the concepts of health literacy, use the lens, as we say with our theme here, of looking at what you're doing and how can you apply health literacy concepts to those processes or as you're redesigning things. So I'm going to stop here for questions. We've still got about 15 minutes. Keep going here. Okay, current trends. Research and interventions. Like I said, first things were how to measure, kind of. Is it important? Yes, it's important. Now we're into research interventions. It takes a long time to do a research project. Anybody who's involved trying to get funding, go from idea to funding to completing the project to actually analyzing it and getting this, the results out there. Foundation funding is quick, 2 to 3 years. Federal funding can be much longer, 5 to 9 years. It takes a long time. So there are relatively few interventions that have rock solid evidence, but there is more and more evidence, and there's a lot of research going on right now. Definitions, continues to be a lot of debate, as I mentioned. I'm going to skip by this, but there is a thing called the Health Literacy Toolshed. I checked it a few days ago. It has 176 measures in 11 different areas. Only 35 of them use a fairly modern approach to developing these tools, so some of the older tools are not really that well validated. I'm not a big fan of measurement outside of population health and outside of research. And the reason mostly is that when you put in those emotional factors like sleep deprivation, anxiety, fear, pain, anything like that interferes with abilities to, anyone's ability to deal with health information at that point in time. Wouldn't it be nice if the folks in the health field were more aware of health literacy? Work is being done about that. Back in the dark ages when I went to medical school, we didn't even talk about it. We were told how to do a history, get information from the patient. Nothing was said about giving information back. Zero, nothing. 35 years ago. But some people are working on it. Some standards about what sort of skills would be needed were published in 2013, and then that was a really long list. And so then there was some prioritization about what would be the most important ones. That came out in 2017. But there are some medical schools, nursing schools, pharmacy schools that are beginning to pay attention to this. It is happening. Variety of policies or organizations who've put standards forward. I'm just going to zip by these things. There is one for prescription labeling and medications. If you're interested, if you're not, well, a lot of you not from the Madison area, but and you're interested, is there somebody else working on this in my state? The Centers for Disease Control, the CDC, has a very good website. They have a map on it, and at least places where there are regional efforts or statewide efforts that they are aware of, you can go to the map and you can find a bit of information. Is there something, is your state colored or not? And then you can click on that and find out a little bit about what's going on there. Effective communication is the key. It's basically written and verbal communication. I'm going to just a little bit about written communication. It's a lot harder than you think to create documents that people can really understand. There's a thing called reading grade level or readability. That's actually really important. If everything's at the 12th grade level, about half the population is not going to be able to understand it at all. But even having it at a lower reading grade level still does not necessarily make it effective. And there's something called plain language. That's a whole nother world. It's about verbal communication as well as text and other multimedia. And there's a couple of references there to how to learn about plain language. There's a lot of discussion about plain language. There's a couple of ways of trying to test documents if you want to. There's a lot of talk about patient experience going on in the healthcare field right now. Unfortunately, for the organization I work for, that's mostly about is there coffee in the waiting room and what's it like, can people find their way around? But they're now starting to get to what actually does it feel like to be a patient going through the system and having things happen to them. There's some ways of measuring that. And then a little bit more recently, something called patient-reported outcomes, or everything seems to have acronyms in our world, also known as PROs. And these are basically patient surveys about the results of care. And this is actually not a new concept, but it's a new name for something that's been done for a while anyway. But a few of them that I've looked at, they were not very tuned in to readability. The questions were a little ambiguous. And I'm guessing that folks that can't read very well are not going to even be able to respond to these surveys, so you're going to miss those folks completely. And I don't think anybody's paying attention to that part yet. There is this new International Health Literacy Association. It's a nonprofit, it's member-based, it's free if you want to join. They have several committees if you're interested in getting involved. They focus on the health literacy field and the development of the field in general, member education, and trying to gather research and best practices as a place to, I'm going to keep skipping here. We have some literacy folks here. People who work with adults who want to learn how to read better or want to learn English as another language can be a great partner. They have an environment where they work with adults who struggle with reading or understanding English. That's the population that they work with, and they know how to do adult education, which we were not taught in medical school, by the way, and probably not nursing school, like how to do adult education. There's opportunities for partnering with healthcare organizations to advise about healthcare delivery and some of the access issues, access as in how do you get there, as well as access, do you understand what is happening and going on. And then, of course, they have their own jargon. So there's, and I'm just quick acronym thing here, ABE, Adult Basic Education. That's the lowest level of adults who are trying to learn how to read better. ASE, Adult Secondary Education. And then there's all these other ones for English as another language. I think we've drifted to the one at the bottom. It's kind of the one I like the most, English language learners, because a lot of the people who are learning English, it's not their second language, it's often their third or fourth language. And so we've moved away from that. There are some curriculum that integrate health into literacy programs, and if you're interested in that, there's ways, I've put some references in there. And then quickly, some other resources. If most of you are new to this environment, great way to find out what's going on and to ask questions. It's a very welcoming environment. Health Literacy Discussion List. Institute for Healthcare Advancement, you can go there. There's 1,500 other people who have an interest in health literacy. You can ask any question and it's okay. There's newbies there, there's people who've been around there forever, and you can keep up on what the latest stuff that's going on in health literacy that way. There's some things about prescription labeling, patient-tested instructions. I don't think we had any pharmacists in the room, but they've been tested, Spanish, Chinese, Vietnamese, Russian, and Korean, the basic instructions for how to take about 80% of the medications that one might take, and that's available out there. There's great evidence for, if you're involved in hospital care, to improve the discharge process, and using this Project RED, or Re-Engineering Discharge, those folks reduce the 30-day rehospitalization rate, people coming back to the hospital within 30 days from 20% to 15%, and decreased emergency department use in that same 30 days from 24% to 16%. And that's a lot of money. That's a lot of people who don't have to go back to the hospital. Great places to find information about health literacy. The Agency for Healthcare Research and Quality, AHRQ, has supported a lot of research. They have a ton of great resources. Centers for Disease Control, the CDC, also has a lot of great resources for health literacy. The organization I work with, Wisconsin Health Literacy, they also have some great resources. I've blasted you with a whole lot of my words. I'm going to leave you with somebody else's words, and then if you want to talk about questions or what to see in Madison, we can do this. But action expresses priorities. And be the change you want to see in the world. These are words from Gandhi. So we have a few minutes. What's that? Oh, I have 20 minutes. Oh, I can't tell time. I could go back and talk a little bit more about the resources if you want me to do that, or we can take questions. What do you want to do? We got a question.
Hi, Dr. Smith. Thank you for your talk. I'm also a family medicine physician here in Madison, actually Middleton. And I guess I agree with you that definitely health literacy is an issue. And I guess I wanted to see what your opinion is as far as how this fits into the larger context of how our healthcare system is failing in terms of not enough time with patients. They've done multiple studies that show that if a physician spends longer with a patient, health outcomes are improved in general. So I mean, if we had more time, obviously, we would have more time to discuss medications and how to take them and educate patients. Then as far as accessibility to physicians or care in general, if patients have questions when they get home, if they call their physician, they're most likely put through a phone tree of leaving a message. Right. So I guess I just wonder how much of this fits into a context of a larger broken down healthcare system that, in my opinion, is only getting worse.
Yeah, great question. So I think, let me deconstruct your question a little bit. So particularly, what can physicians do? And the answer is, it's going to be really hard. I mean, we can't do all of the work in explaining that needs to happen, but we can figure out the plan. We are moving toward more team-based care, and so I think actually that's going to be the answer, where we come up, we do the evaluation, we get the information from the patient and that sort of thing, or it gets gathered in other ways and we digest the information and then act on it or confirm things and explore things more with the patient. And then come up with the plan, negotiate that with the patient, and then have somebody else, a nurse or some health educator or somebody else who's available to go over things in greater detail. I think that's what's going to have to happen. And then how do you, when people have questions later, we need to have a system that's set up for that so that people have somebody to talk to. There's usually a triage nurse or somebody else, but you don't get to talk to the doctor directly very often, and we know that. So I don't think where we can have the most influence is as providers to point out, as you just said, the system is broken and we need to fix it. We need, as a system, to figure out ways to do it better so that people can understand.
So I mean, kind of counter to your point, I actually have a direct primary care practice, so I spend an hour with my patients. I don't operate within the insurance system. So
okay.
That to me is one of the solutions, but you're right. Within the insurance system, physicians have very little time to access to their patients. So.
Yeah. Yeah, so you don't have a good excuse, do you? But it's all the rest of it. It's all the rest of it around you. It's the insurance companies and trying to wade your way through that, and what happens when you get to the hospital and all those other things that you're not part of. And yeah, it's a pretty broken system. Other questions? Yes. Could you go to the mic because we're recording this?
Yeah, my question is, so we've talked about the problem, but if you look at it in a clinical situation, and I have a family member who has health literacy issues, when they walk into the doctor's office, they don't come in and say, you know what, I can't read.
No, they don't.
They don't. And so how do you tackle that? How do you take that first step and then you combine the limited amount of time, unless they have somebody else accompanying them to help them in that situation?
Yeah, so you just mentioned a couple of solutions. One is to encourage people to bring somebody else along, especially older folks. But I'm not that old, and my wife and I go together a lot because it's very hard to be the interactor and the one who's like thinking and maybe writing things down and that sort of thing at the same time. So that is one thing that definitely can help. And now I've lost the train of thought. What was the other part of your question?
The other part was if they come in, just identifying that they have an issue.
Oh, yeah, an issue with, yeah. So that's part of the sort of measurement thing that I don't like. So if you have the idea that you can't tell by looking at somebody whether or not they're understanding, and understanding, I only went over a few of the things. What your background is makes a huge difference. And so I have college professors who come in and they're an astronomy professor and they don't know squat about how their body works because they were asleep in health class in high school or whatever. And so being literate doesn't tell you what they know about anything. So one way is, whatever it is you're going to talk about, is to start off with saying, what do you know about ear infections or bronchitis or whatever the topic is? And so that can give you a place for, well, are you pretty familiar with it already or not? And then how do I build on it from there? The other thing is you have to prioritize, and I hate to say this, you can't teach back on everything. You just can't. So I've chosen that I want to try to get the medications right. So especially if if they're getting a new medicine that I'm prescribing, I want to make sure that part they've got right. And teachback's the best thing we have. The evidence for that is not super strong, but it's at least a start where you can say, here's the medicine, here's how you're supposed to take it. I actually type out very patient-specific instructions on my quote after visit summary or dictate them. And then we look at the screen together and go over it. And then I say, okay, now you're going to go home. how are you going to take that medicine? And see if they've got it right. And this is especially important if you're working with an interpreter to do that, especially about medicines. They get messed up all the time, and with interpreters, it's another layer more difficult. And so if you can at least do those few things, you're making a start in the right direction. But starting with what do you know about this already gives you a place, and then what are the key points? And the other thing is to try not to overload people. It's so easy because we can only keep 2 or 3 concepts in our head, and if they're not taking notes, then beyond that, they're going to start forgetting stuff. Questions? Yes, sir.
Yes, Dr. Smith, during your presentation, you had some dates up there, 2003. Mm-hmm. Is the government updating any of this? That information's 16 years old.
Yeah, well, it is. But like I said, in the 20-year history of measuring 3 times, even though it wasn't exactly the same, it really didn't budge at all. So as of what I've heard is that there are no plans to do it again. One would hope. Europe is taking it a little more seriously, and they've done some repetitive measures. Yeah, one would hope. I'm not sure it really, frankly, I'm not sure it changes things a whole lot. We know it's bad.
So in
it
your
would be nice to know where we're
it
at.
hasn't changed much?
Yeah, maybe you missed that part. In the 20-year, between the first and the third, even though they use slightly different measures each time, it essentially didn't really change.
Okay, thank you.
In 20 years. Other questions? Yes.
A while back, the AMA had a really strong effort for health literacy, and all of a sudden, all of that content is gone. Do you have any idea if is that going to resurface, or you have any knowledge of this?
I'm not sure which things. There's the communication assessment thing.
The Speak Up program, and they had a CD-ROM and a booklet on talking with your patient. It's not ringing a bell?
Yeah.
I'm pretty sure it was the AMA.
Yeah, I can't say. It did sort of peter out. There are similar resources or more evidence-based resources, I think, that kind of replaced what they started with. I mean, they did a lot to sort of get things going, but the communication climate assessment never really took off for reasons that are not entirely clear to me, other than it's a lot of work to do it at an organizational level. And that part, I know, they transferred. It's actually still out there. They transferred it, the ownership rights to someone else, but it still hasn't really taken off, that part of it. I think they've kind of moved on to other things. They did help get the ball rolling back in the day.
Okay, thank you.
Yeah. Yes.
Hi. Thank you so much for the talk. It's been really interesting and informative as somebody who's pretty new to the field. And I'm just wondering, as a physician, aside from sort of the things that you can do in clinic with a patient, are there any sort of like patient education resources or materials that you can bring in from the outside that you personally think are effective?
Good question. Yes. There's a couple of sources that I can tell you. So there's a thing called Medline Plus. Anybody here heard of Medline Plus? Okay, it's by the National Library of Medicine, and off on one corner, I think it's down in the middle now, it used to be on the right, is a easy to read section. And so it's a place to start. So just so you know, the National Library of Medicine doesn't test those documents. They accept the definition of the author, and they sort of certify the authors, but they don't certify the materials the authors create. So you still have to look at them and kind of critically evaluate them. And if there are several ways of trying to do that. And there's Agency for Healthcare and Research and Quality has something called PMAT, which I could flip back and tell you what that stands for, but it's an assessment that Centers for Disease Control also have a way of assessing documents. And so you can get, if you start looking at plain language and what's important and that sort of thing in terms of style and how it looks and that sort of thing, as well as the readability, the reading grade level, and you put that all together, pretty soon you find out there's a lot of bad stuff out there. But that's a place to start, is the easy to read stuff and Medline Plus. And the other one, the Institute for IHA Healthcare Advancement, has some what to do books that are, I think, at 5th grade level. And those are very well written. That one of them is what to do when your child is sick, what to do when you're pregnant, what to do with obese children. There's, I think, 5 or 6. So they have some really good materials that are available. So that's 2 sources that I'm aware of. Yeah, the other thing you can do is you can just put the topic in and type in easy to read. And sometimes something will pop up and somebody's used that phrase because it gets used a lot. And there's not one repository like, here's all the good stuff. It's not there. It's like all over the place. So there are some really well-written materials, but you have to kind of go find them. Welcome. Got a few minutes to travel in Madison. You want to hear about some cool places to go see? Yes? Sure. Okay. Okay. So I do have these restaurant guides. There's 2 pages. The front page, I've actually been to every single one of those places. You can walk to many of them. There's some really good restaurants in Madison, like really, really good place. This is a foodie town, big time. We have a free paper called the Isthmus, and they just came out with their latest dining guide. But so if you want to look even more and rankings and ratings of some of the restaurants that are around here, you can go to their website. Couple of things, if you are into chocolates, we have one of the best places to get chocolates in the country. Consumer Reports, probably, I don't know, it was like 5 or maybe more than 5 years ago now, looked at Godiva's and all these like big national names, and there's a place called Candina's that's here. They were top ranked, and they're on the square downtown. It's about a 5-minute walk. They're expensive, but my wife says they're really, really, really good. And the University of Wisconsin, we are in a farm and dairy state, you know, cheeseheads and all that sort of thing. They do research about ice cream. How could it get any better than that? Well, you got chocolate and ice cream, right? But the Memorial Union, the Student Union, is also a very cool place to visit. It was recently renovated. It's over on the lake. It's a fair walk from here, but you could take a cab if you wanted, or Uber or something like that. And there's actually bicycles around here too, we'll talk about in a minute. But Babcock Hall is the place where they do the ice cream research, and you can get Babcock ice cream at the Student Union, and it's a really good ice cream. Places to check out. There's a street called State Street that is kind of a hub between downtown and the university. It connects, it's a fair walk. You'd have to get to the other side of the square and then walk, but if we get some nice weather, it's just a cool place, lots of shops, restaurants and things like that. The Capitol building is open every day. You can just walk right, you have to go through, metal detector and that sort of thing these days, but it's a really cool building. They have this amazing mural up in the dome, and you can just kind of wander around. It's a really cool place. Too far to walk, but we have botanical gardens. It's indoor, very interesting place. We have a free zoo in Madison, so you don't have to pay anything. They're open. You can go walk around. You'd need a bike or a cab to get over to that. We have a museum of art. It's downtown. If you've got kids along, actually it's kind of fun for adults too. The Madison Children's Museum is also on the square, not very far walk from here at all. And a little bit further for a walk, but not that far. We have a really cool, very small geology museum. We've got some really cool fossils and dinosaurs there, so very interesting. And then I mentioned Student Union already. And this is also a biking town. It's one of the biggest biking towns in the country in terms of facilitating that. And there's where so many bicycles that you can rent them very easily. And they're within a couple of blocks, there are places that you can rent bicycles. It's $6 a day or $15 a month. So if you were going to use one, and there's rules about it, like you actually for each day you can only use it for like 45 minutes at a time or an hour at a time. It's just to get you someplace, and then you drop the bike off at another location, and it's all online if you want to check it out. And then there's Uber, of course, and I think we have, I know there's Uber here. And then Green Cab of Madison, they're all Priuses. So and they tell me, I have a Prius, that they get 350,000 miles out of those Priuses. That's what the guy at the Toyota dealer told me when I was worried that mine had 150,000 miles on them. So they use them for a long time and not as much gas as other places. So, and that's the end of it. And if there's a cool picture for you to look at. So anything else? So definitely download the PowerPoint. There's the links. I checked all those links like a couple of days ago, so they were all active at that point, when I did it, although it's amazing how quick those can change. And tons of resources for you if you need them. So thanks for coming.